Has your loved one who's living with dementia ever accused you of stealing their money? Has your loved one who's living with dementia ever accused you of being in a relationship with their husband, right? That is paranoia, which is very, very common in dementia. My name is Dr. Eric from MedBetter Health, and in today's lesson, we're going to talk about how to deal with paranoia. You ready? Let's go. So, when we take a look at it, very often your loved one's going to say something like, "You stole my wallet. You are lying to me. You're trying to abandon me." And you know what? Sometimes they could even say it around other people who are in the room, and you're sitting there and you're like, "Oh my God, like, what are they going to think? I know that's not a reality," right? So let me teach you what you need to do. Well, first of all, let's look at the statistics. 34 to 63%. That's the frequency of psychotic symptoms in dementia. And when we look at specific symptoms, right, you have paranoia, you have appetite changes, sleep disturbances, disinhibition, agitation, anxiety, apathy. What are all these? These are all known as BPSD. Dr. Eric, what's BPSD? Those are behavioral and psychological symptoms of dementia. All right, I want you to remember that. Behavioral and psychological symptoms of dementia. So when your person living with dementia has any of these, don't take it personal. These are actual changes in the brain that cause behavioral and psychological symptoms of dementia, BPSD. Okay, let's take a look over here. So I actually want to talk about this slide over here. Perception filters, neurotypical versus dementia reality. Neurotypical, this is what you see. A safe environment, you see a couch, you see a mirror, you see everything is clear. What is your loved one? What is a person living in dementia? They actually have a different lens. Look, they're actually seeing a ghost in the mirror. They're actually seeing a shadow, a man who is waiting for them to kill them. They're seeing that. Just like you're seeing me now on social media, this is what your loved one sees. They're hearing all these scary noises from the TV. The books look like weapons to them in their mind. Those are some sensory alterations that happen. So, sensory cues are easily misread. Now, there's a difference between your loved one having sudden paranoia, where it's just like they were fine and then all of a sudden, within 24 hours, they're accusing you of stuff. Don't just blame it on dementia. If there's a sudden change in mental status, you've got to say that's a red flag. What do? Well, I got to make sure it's not a UTI or another infection. I got to make sure they're not in pain somewhere. Maybe they're constipated. Maybe they haven't gone to the bathroom in 4 or 5 days and nobody has mentioned that. Maybe they have severe dehydration and they're just so dehydrated and they have electrolyte abnormalities in their blood. When there's a sudden change in behavior, whether it's paranoia, anxiety, agitation, you've got to rule out physiological causes first. Or it could be a new medication that was started. Or they didn't get sleep last night because the music was too loud, or they came home late after a party that you took them to, right? Whatever it is, you have to rule out acute causes first. Now, if a patient tells you, or your loved one tells you, "You stole my money," that actually doesn't mean that they think you stole their money. In reality, the behavior is this. They're telling you, yeah, you, the caregiver, they're telling you, "I am terrified because I don't recognize my surroundings and I feel completely out of control. I'm not in control." That's what they're telling you when they say you stole something. So the accusation is a fear signal. It's not a factual claim. So your job, and this is so important, is not to defend and be the defender of the truth. "I didn't steal your wallet. I'm not sleeping with your husband." That's not your job. You're not going to win. Why? Because arguing facts will always escalate. Will always. Let me ask you, you're watching this video right now. Someone comes to you and says, "You're not watching social media with Dr. Eric from MedBetter Health. You're not watching him. You're not seeing him. What are you going to do? What are you going to say? You're going to argue with them. You say, you nuts? I'm definitely watching Dr. Eric. Same thing happens with your loved one. So therefore, do not argue. There's something called the caregiver response matrix. There's instinct, what you want to do, and then there's the best practice, what you should do. So your instinct tells you, let me tell them the truth. Let me tell them I didn't steal it. You're wrong. The actual result is going to be escalation. The patient feels unheard. Their threat detector spikes further. They feel a lot more aggressive. Here, the emotional response, that's validating the emotion, regardless of the facts. You're not validating the fact necessarily. You're validating also the emotion. I understand that you feel a little scared because of what you're seeing. Let me try to take that away right now, and I'll remove it so that it doesn't bother you, right? You're not arguing with them, okay? De-escalation. The patient feels that you've heard them and you're lowering their anxiety. So let's go through the de-escalation loop. Number one, acknowledge. You hear the fear, you pause before reacting. So first you hear them out and you pause before right away jumping into reaction. Number two, remember, validation. It's actually called validation therapy. You match the emotion. You don't have to agree that something was stolen. You agree that they feel scared and unsafe. Listen, I agree that you're feeling a little unsafe and that you think that's something. I hear you, Mom. I know exactly where you're coming from. I hear you and I understand you. That already de-escalates the situation. Then you say, you partner with them. That's important. You're not aggressive. You're not fighting them. You're partnering with them, and you become their ally for theft accusations. Calmly search common locations. Let me help you. Let me look over here. Oh, yeah, let's search, Mom. Right? You're partnering with them. You're not escalating. You're not being aggressive. And then, very important, you're redirecting. You're saying, oh, Mom, look over there. Look at that beautiful picture of our grandchildren. Mom, look, remember this picture of Dad? You guys look so beautiful together. Redirect. Put on a Frank Sinatra song. Fly me to the moon and let me play among the stars. And so they're like, oh, wow. Now they're thinking about music. They're not thinking about that wallet, right? Mom, remember the dance you had with Dad to that song? That was so incredible, right? That's what you're doing. You're redirecting, and you're not actually going and aggressively engaging your loved one. So this video, there's a lot of content that we go through, and I'll continue, but before I go into medications, you as the caregiver, a lot of the times you feel alone. You feel like there's no one there to help you. You don't know how to manage everything. You Google a little bit here, you go to ChatGPT a little here, but you're not really sure who to talk to. And Medicare started a new program that our organization is part of that actually, you could think about it as holding your hand. Think about a vision of having your own concierge care navigator who you can call and you can talk to. Like on our team, we have Sabrina, Zayed, Yekaterina, Irina. Imagine calling them and saying, hey, I've got a problem. I'm trying to make an appointment to a cardiologist for my mom, and they're giving it to me in September. We're in May. I can't wait that long. Imagine if they actually say, don't worry about it. We got you. Let us call and make it for you. We're from a medical organization. We'll care navigate. We'll help you. Or imagine calling and saying, look, I'm so exhausted. It's a Sunday, and I really want to have a couple of hours off. I want to have 4 hours to go with my kids to the beach. We haven't gone. I was talking to a lady yesterday who told me, I can't leave my mom alone. I just can't. And she used the word, she's like, I feel like I'm in jail. Comment below if sometimes you, the caregiver, you feel like you're in jail, like you want to get out, but you can't. But imagine a world if you can call someone like your care navigator, and then they could arrange free of cost. It doesn't cost you anything if mom has Medicare. Someone to go on Sunday into your home, sit with mom, make sure everything's okay while you, the caregiver, can get respite. Well, that's not a vision anymore. That's not a dream anymore. That actually is a reality. And it's called the guide model, the Med Better Health guide model. So if you're interested in the guide model, Very easy. Scan the QR code over here, or visit our website right here, or click the link in the description, and I'm telling you, it's super easy. It's going to change your life.